Yeah, so when we talk about our mission and the work that we do, we often put it in the context of both health disparities as well as social justice. And that's because we have a system in the U.S. anyway where we've chosen to primarily privatize or create a business model around both insurance coverage as well as the purveyance of the healthcare services and resources. Now there's quite a bit of public in there too, but for the most part it's meant to be a predominantly private system. And you know, not judging that one way or the other, but in that case it does create a gap between those who can afford it and those who can't. And I think it's been well documented that the U.S. has the world's most expensive healthcare system. And the gap between those who can afford it, it's unaffordable for many people, but obviously the lower income you have, the less likely you're going to be able to afford it. So we feel it's very important that people have access to healthcare. And if they don't, then they suffer the consequences of negative health outcomes. The taxpayers also suffer because those people don't receive care in a timely manner. They end up in the emergency room anyway, and it's still going to cost the system money. So when we think about social justice, what we're really talking about is mining that gap between the patients who can afford the system and those who can't, and making sure that those who can't, there's really only two options. You can either create government-run healthcare and provide resource to all, or you can use charity as a means by which to kind of help cover that gap between the haves and have-nots. And to us, at least when I speak about social justice, that's what we mean, that there's a common need and a common good to making sure that people have access to quality health care. And there's not that many ways to do it. We've chosen a particular way to do it here in the United States. And if we're going to continue on that path, then the way to make sure there's some justice in the distribution of that resource is to use charities and subsidies and safety nets to try to help those patients who can afford it, the working poor essentially, and those who have fallen through the cracks, in large part because of their disease, to make sure they have some way to access health insurance and health coverage and utilize the services that will make them better so they can get back and be a productive member of society.